Welcome to this Explainer. Today, we're breaking down the complex science of menopause. We're going to take this from a feared medical condition to what it truly is, a totally manageable, natural life transition. Let's jump right in.
Before we get into the data, I really want to challenge a prevailing myth by asking you a crucial question. Is menopause a disease? It's a super common misconception, but the answer fundamentally changes how we approach women's health. And that answer, it's a resounding no. It's a natural transition, and treating it as such is the absolute most important first step we can take.
Here's our roadmap for today. We'll cover the natural menopause transition, systemic impacts and symptoms, diagnosis and global guidelines, comprehensive treatment and lifestyle, some real-world clinical scenarios, and finally, empowering life after menopause.
All right, Section 1, the natural menopause transition.
Let's clearly define our core term right off the bat. Menopause is the permanent cessation of menstruation, and it's officially diagnosed after 12 consecutive months without a menstrual cycle. Pinpointing exactly when this occurs is absolutely foundational to understanding all the physiological changes that follow.
Now, when we just use the umbrella word menopause, we often completely miss the actual timeline. Think about how this maps out across a lifespan. You've got premenopause, roughly 10 years prior, perimenopause 1 to 5 years prior, that actual milestone of 12 months without a period, and then postmenopause, which, by the way, can stretch out for 30 or more years. This is a major, gradual phase of life, definitely not an overnight event.
Let's break down the hormonal domino effect happening behind the scenes. First, follicle depletion in the ovaries directly triggers step 2, a huge drop in estrogen and progesterone. And because those hormones tank, the brain tries to compensate. That leads to step 3, elevated follicle-stimulating hormone, or FSH, and luteinizing hormone, LH. It's basically a biological chain reaction.
Moving on to Section 2, systemic impacts and symptoms.
The real kicker here is that estrogen decline doesn't just stop your periods, it directly messes with the brain's internal thermostat, causing vasomotor symptoms like those notorious hot flashes and night sweats. But it also affects pelvic tissues, leading to genitourinary syndrome, causes cognitive changes, brain fog, and even triggers musculoskeletal issues like joint pain. The impact is literally systemic. We really have to distinguish between short-term disruptions, the insomnia, mood swings, and hot flashes that you actively feel, and the silent, long-term systemic risks. We're talking accelerated bone loss, increased risk of cardiovascular disease, and central obesity. Understanding this distinction is exactly why proactive preventative care is a total game changer for your future health.
Okay, Section 3, diagnosis and global guidelines.
I want you to focus on this number, 12. This specific number represents the consecutive months without a cycle that are required for a clinical diagnosis. Basically, what this tells us is that, for most women, keeping an eye on your symptoms and menstrual history is actually way more important than rushing out to test your hormone levels.
While routine hormone testing isn't usually recommended, there are essential physical investigations globally advised by organizations like the World Health Organization and the North American Menopause Society. Since clinical history is the primary focus, tests like FSH and estradiol are reserved for very specific situations. Instead, the focus shifts to protecting your long-term health with tools like DEXA scans for bone density, lipid profiles, and HbA1c tests to check metabolic health, plus your routine mammograms.
Section 4, comprehensive treatment and lifestyle.
When it comes to treatment, we generally see two distinct pathways. Menopausal hormone therapy, or MHT, is incredibly effective for hot flashes and bone protection. But for folks who can't take hormones, there are robust non-hormonal options using medications like SSRIs or novel targeted drugs. This just highlights that modern menopause care is highly individualized. There is absolutely no one-size-fits-all approach here.
But hey, treatment goes way beyond just taking medication. Targeted physical rehabilitation protects both the urogenital system and our skeletal framework. Pelvic floor physiotherapy helps manage urinary urgency through bladder training and Kegel exercises, while osteoporosis rehab focuses on weight-bearing exercises and balance training to prevent falls. It's all about building a strong physical foundation.
Let's bring this to life in Section 5, real-world clinical scenarios.
Imagine a 56-year-old patient. She represents a very common, yet often completely silent risk of postmenopause, accelerated bone loss leading to dangerous fragility fractures. Because dropping estrogen triggers a bone remodeling imbalance, osteoporosis can easily sneak up on you if you aren't being proactive. But
Through a targeted, comprehensive bone health program, the entire trajectory changes. It proves that combining modern medication, like bone-strengthening bisphosphonates, with specialized physiotherapy can effectively halt this decline. It's a perfect example of how blending pharmaceutical and lifestyle interventions completely stabilizes bone health.
Now let's dive into another super common but rarely discussed clinical case. Here we have a 54-year-old woman suffering from genital urinary syndrome of menopause, or GSM. She's dealing with urinary urgency, recurrent UTIs, and painful vaginal dryness. These are symptoms that so many women silently endure, mistakenly thinking they're just an inevitable part of getting older.
The absolute crucial point is that she didn't just have to live with this discomfort. Her highly individualized, multidisciplinary treatment plan included localized vaginal estrogen therapy combined with pelvic floor rehab and bladder training. This comprehensive approach completely resolved her pain and urgency. It beautifully restored her quality of life. And finally, Section 6, Empowering Life After Menopause. The landscape of care is rapidly evolving, giving us an exciting look into the future. We're talking about precision hormone therapy, tailored to individual genetics, AI-assisted menopause care, and even wearable symptom monitoring to track physiological changes in real time. These advancements are going to make managing symptoms even more seamless down the road.
I want to leave you with this really powerful thought from our sources. Menopause is a natural transition, not a disease. Knowledge, early intervention, and compassionate care empower women to thrive beyond menopause. This perfectly reinforces that with evidence-based medicine and comprehensive care, you can absolutely remain active, healthy, and independent throughout the second half of life.
So now that you have the facts and you understand this vital paradigm shift, I challenge you to ask yourself, how will you take charge of your health in the second half of life? Use this knowledge to advocate for yourself, consult with your healthcare professionals, and confidently build your own incredible future. Thanks so much for joining me for this explainer.